I'm called Nashigude Elizabeth, 12 years of age. Because of HIV drug resistance, I lost both my parents. I've grown up with my grandparents with little family support. That's why I have failed my first and second line. And now, it looks like I'm going to die because I don't have third line medication.
I am a mama, I am a mama, I am a mama, say no to resistance.
Good afternoon, ladies and gentlemen. HIV drug resistance is a big problem in Uganda. Many people are failing, and I'm bringing you testimonies, examples of people who have failed medications. Doctor, community wants to know, what is HIV drug resistance?
Resistance means if someone is on treatment, but the virus keeps on replicating or keeps on multiplying despite the presence of the drugs. HIV drug resistance is mostly caused by poor adherence. There are a number of things that can cause it, but the major way how this comes about is through poor adherence. Poor adherence, what I mean is someone is not taking their drugs the way they're supposed to. You know, when they make these drugs, they're supposed to be taken at a certain time, and a certain number of times in a day, in order to maintain a good amount of drug in the body or in someone's blood, which is able to kill off the virus. Now, what happens sometimes people take their drugs inconsistently. They swallow today, they don't swallow the other day, or they take half doses, they don't take all the drugs. And when that happens quite often, the virus is exposed to lower doses of the drug, which is not able to kill it.
Kyenjagala obagamba nti bwe mutamira ddagala mufuna obuzibu, mufuna complications eziba ziyinza okutataakanya ekiba kitandikibwawo n'eddagala.
Dr. Henry Mugerwa, is there any other cause of HIV drug resistance apart from poor adherence?
The major characteristic of this virus is known to be changing a lot, what we call mutation or mutating. It keeps changing its form. So through mutation, the virus can change and then also cause drug resistance. But another thing also which may result in drug resistance, this is whereby someone who has even never taken the drugs, or even if they've been taking their drug, they're supposed to be taking their drugs well, but they acquire a virus which is already resistant.
When I started the drugs, I was on the first line. I swallowed well, but in 2000, the doctors found out that I was not doing well, and I was wondering why I was not doing well, because I was swallowing the drugs in the right time, in the right way, and the right dose. So they told me that the drug has not worked in my body, and they had to change my drug then.
So it's more likely that you got resistance from the husband.
That's what I suspect, and that's what the doctor thought, because my husband was not taking drugs in the right way. So he was not adhering well, and for me I was adhering well. So the mixture could not make my drug work in my body well.
That has been Anne Romoshana, one of the people who have failed medications and they have overcome HIV drug resistance. The message we pass to the general community is when they tell you to take your medication 2 times 2, please take it 2 times 2. When they tell you to take 3 times 1, please take 3 times 1, not 1 times 3. So follow the instructions of the doctor. And we also want to tell you that not every people who fail treatment fail because of poor adherence. As you've heard from Anne, some people actually get resistance from their partners. Doctor, currently there is a big concern. Do you have Ugandans who have failed both first and second line?
Yes, we are having them. Actually, we are seeing a growing number of people who are failing second line. So because of some of the issues we talked about earlier on, of adherence issues, the virus sometimes changes. So we also get some people who fail second line, unfortunately. And we are having a growing number of people who are failing second line. in Uganda. Right now, actually, there's an ongoing survey that is trying to look at the number of people, the total number of people who are failing second line to estimate the number. But for example, here at JCRC alone, we are taking care of about 300 persons who failed second line, and they're on what we call currently third line treatment. So yes, there are a number of people who are failing second line, and the number is growing with time.
It is very important people to know that we have some Ugandans who have failed first line and second line. And as we speak now, they badly need third line medical intervention. Right now in Uganda, there's no policy, there's no budget for third line.
Amanya gange nze Kigundu Musa.
Kigundu Musa obeera wa?
Mbeera Masaka.
Buzibu ki bw'olina?
Obuzibu ennyo eddagala first line yasooka n'egaana nengenda ku yookubiri kati ndi ku yakusatu.
Oli ku yakusatu. Eyasooka bwe yagaana walwala nnyo?
Nalwala nnyo ng'era sikyasobola na kutambula.
Kati bakukyusa ne bakuzza ku line ey'okusatu owulira otya?
Neewulira bulungi kuba kati ne kyenjagala nsobola kyetuusaako.
Kati okutya kwo kuli ki?
Okutya kwange eddagala bwe baŋŋamba nti lyawuddeyo mu ddwaliro oba ligamala emyezi 2 nga teririiyo, kwe kutya kwange.
Kwe kutya kwo. We have a caretaker, Mama.
Okusaba okwange nsaba abayambi abatugulira eddagala ly'omwana kubanga lya ssente nnyingi tetusobola kulyetuusaako ate tutuuka mu ddwaliro ne batugamba nti eddagala teririiwo lya kugula buguzi. Kwali tusaba kutuyamba batugulire eddagala ly'omwana eryo kuba tetwesobola ate nga lya ssente nnyingi nnyo. Kati badde tusaba batuyambe.
Kiki ekyakuviirako eddagala erisooka n'eryokubiri okugaana okukola?
Eddagala nasooka awo nga ndizanyira musirimira bulungi ekyanviirako gaana okukola.
Kati wakimanya nti okuzanyira mu ddagala kibi?
Iye.
Kati eddagala eririwo olimira bulungi lyo?
Lyo ndimira bulungi.
Yes, it is very important to know that when you treat a child who has failed, he can look good as you see. The issue of HIV drug resistance is a very big problem in Uganda. Right now, there is only one treatment center which can offer third-line intervention, and that is Joint Clinical Research Center. We thank USAID and the people of America for the great support, and we pledge them, we ask them to continue supporting. We also want to inform Ugandans that it's very important to adhere to your medications. Please take your medications as told by the doctors. The main reason why people fail is because they don't take their medications properly. Bubaka ki bw'oyagala okuwa abantu naddala bavubuka?
Naye nga tebatya kwogera kusaasaanya message eri abantu abalwadde nga bo.
If we have people who have failed second line and you are treating them, we understand there is no government policy, there is no budget to provide third line. The government just introduced guidelines. Where do you get the medications for third line if there is no policy and budget for third line?
Being a research organization, we first got some of these drugs through the researches that we are doing. The sponsors of these studies would provide these drugs. For example, currently we have the third line protocol which is running right now by the ACTG, which is looking at better ways of using modern technologies in identifying what better treatment to put on people who are failing second line drugs. So that study is able to provide treatment for people who are failing second line. That is providing for them third line drugs. But also JCRC also managed to work with the government to lobby, you said, whereby we got a small grant to be able to also provide some third line drugs through USAID. But as you said, it's still on a limited scale. So actually currently, I think at the moment JCRC is probably the only referral site for people who are failing second line treatment, and they need third line treatment. And we anticipate that soon we are going to have the numbers increase quite dramatically. We have already been approached by a number of other providers wanting to refer their patients for treatment here because they have failed first line, they have failed second line, and they have run out of options.
I am a mama, I am a mama, I am a mama, say no to resistance.